So we want to look to 2021 as the place that you can actually make gains, that you can enhance your business performance at your practice and have a greater ability to meet patient preference, because that's where a lot of decision making is getting done. So thank you for joining us. We can introduce ourselves real quick. I always laugh wondering if anyone will think we look like our headshots. My name's Norm Schrager. I'm a senior strategist at PatientPop. Alyssa and I, working together, we develop insights, do research and talk to physicians and other providers, all to gain the right information to help private practices thrive. That's what we do at the company. We do a lot with industry trends, and we keep our eye on what's going on so we can share what we know with folks like you to help your businesses succeed. You're obviously physician practices first, but there's a business to run as well. That's what we want to help with. I've been working with healthcare practices of all kinds since 2011, and I previously did that with Athena Health. I introduced my partner for the day, Alyssa Grates. Hi, Alyssa.
Hi, Norm, and thank you. Really glad to be here. And I like to think of those photos there as our pre-pandemic photos. So,
oh gosh.
So similar to Norm, I've been working in healthcare and technology for more than 20 years. And most recently, more so in healthcare, really enjoy the intersection of those two fields. And thank you for hosting and having us today. Glad to be here.
Thanks, Alyssa. Just a quick moment, if you're not sure who and what PatientPop is about, we are the industry leader in what's called the practice growth category. So we have an all-in-one platform that practices log into each day. It's helping thousands of healthcare providers of all kinds promote their practice online, attract and satisfy patients, and then have the tools to retain them for life. So we know the acknowledgments you see there don't happen unless we're doing our job well. We're helping practices thrive, and we take a lot of pride in that. We feel a great level of responsibility in that. So that's our company introduction. And with our help from Emily, our producer today, we can go through just some hit points for today's session. We'll talk about the idea of practice growth. What does that mean? How does the checklist help promote growth for you? We'll key in on certain tips, beginning with your practice website. We'll talk about the value and importance of online reputation. That pretty much refers to your online patient reviews. Talk about delivering an optimal, convenient is the key, patient experience, demand for which is absolutely on the rise. And finally, ways that technology can work for you, make your day easier, get your staff happier, the front desk more efficient. So let's start by identifying the need to improve practice business performance and how physicians and other providers have defined practice growth for us. We do a lot of survey data. And in research that we conducted early in 2020, a little less than a year ago, about 9 out of 10 healthcare providers said their practice is in a competitive market. Not much of a surprise there. About 1/3 called their local area highly competitive. So we can surmise they may be feeling the pinch of new care settings that have moved into their market. They might be in a highly populated city or busy suburb. The big brand urgent care centers, the big brand dental groups, these are very good at determining just where to open a new practice. And they could be feeling the pinch. This is the foundation as to why practice growth, as we see it, is a fairly universal goal, just competition. Alyssa, this is all you.
Yes, thank you. So in that same survey research, we saw that 7 out of 10 providers in our research told us that they gauge growth by more patients. And that was the choice twice as often as the second option that you see there, which was a tie between more staff and greater profit. And we found that providers often define growth as something they need or desire at their practice rather than something they already achieve. So those practices that selected more patients here were more likely to also say they need to improve their patient volume.
Right. And we should point out that the reason we're saying healthcare providers is because the survey respondents included physicians, included PAs, included dentists as well.
Yes.
So we asked about the following performance measurements. And the goals range from patient communication to patient volume to market visibility. And here's what respondents told us. Which of you achieved at your practice? And we found that none of these key indicators of a good, strong practice performance had been achieved by even half of the respondents. Now, some have achieved more than one, but overall, these numbers indicate that most practices admit they have work to do to reach these goals in the way that they define them for their business. So today's checklist responds to that. It's a basic set of tips to help anyone achieve what's most important for their practice growth, for their practice well-being.
And more than two-thirds of providers, too, in that survey said that face-to-face interaction is most important to their practice, and that's really common sense, and that's at the core of the customer service there. Being able to treat your patients the way you want, with care and empathy from that moment that they enter your practice or log in for a virtual visit is really important. However, some of the other options have become part of this tremendous shift, which has greatly accelerated in these times too, and that's to deliver on patient expectations and preference. And digital communication and online reviews, as you can see here, many are overlooked right now as not important, which is really a big mistake right now.
Yeah, and we've got some patient preference data to show why that's a mistake. Even before COVID-19, digital convenience was becoming a tremendous part of what patients were saying was important to them within the patient experience. More than 40% will form opinions about you and your practice based on the way your website looks and feels and what it says, what it's telling them, how it's educating them. Nearly 6 out of 10 folks, as you see there, search online for care with some regularity, defined as either sometimes or often. So even if they're looking for information about symptoms, which, as you all know, is a huge Google search, if your website, if your professional profiles out there are talking about these symptoms, are essentially answering their questions and sharing your approach to treating these conditions, you have a better chance of surfacing high in search results. Even if these folks aren't ready to book an appointment, you're successfully answering their questions. 2/3 of patients told us they prefer text messaging for appointment reminders. This was a landslide. I think the second choice for how would you like to receive an appointment reminder, I think got 13%, and that was email. So it's slightly less, they slightly less want you to text them when it's time to book their next appointment. But that's still I believe in the 50s. They're actually telling you how to best approach them for a return visit, which is such a wonderful open door. And more than 7 out of 10 find online reviews important when selecting a doctor. This is the foundation as to why we're talking about practice management and patient communication today. Why we hope the checklist we've created will help you respond to these types of preferences, help you satisfy more patients, and really feel that improvement in your practice business performance. So we wanted to give that level of introduction so you understand where we're coming from. What I did want to share here is some very recent data. The green line, I don't have any notes on this, so I'm going to riff. That's how new this is. The green line is PatientPop practices from a period of time starting pre-COVID. You see the pre-COVID baseline is the week of March 1st. And you see how practices, I'm making the line with my finger for no good reason, how quickly it took PatientPop practices to return to their level of scheduled appointments that existed before that tremendous dip in March and April that everybody had to contend with. The blue line is a national average of visits. And you see how much longer it took the national average to return to its pre-COVID baseline. So we like to share this as a wonderful little reference that shows that when PatientPop practices are responding to patients and providing that convenience and using the digital tools that are available, they were able to recover faster from the most serious business gap in recent memory. So thank you for letting me riff on that and share that. And now we would love to get into the checklist with you. And we'll start with how your website contributes to that success. Now, when your practice website is running on all cylinders, it's a pretty powerful tool. You want to look good, that's important, of course, but your site has to be developed in a way that gets you high rankings in search results or positions you for those high rankings, that it will attract the right patients to your services and to your business. When you show up strong in search, especially local Google search, and we'll talk more about that, and patients like what they see on your site and they understand who you are and what you offer, they're far more likely to convert, as marketers call it, right? A conversion is they go from being a website visitor to suddenly now they're a new patient. You've given them the tools to book an appointment with you. Now, part of that is what you say in your actual search result. How do Google and other search engines know which information to display? You're telling them from each page of your website. So if you know back-end website development, you'll bear with us. If you don't, we hope this is initial valuable information. Now, there are ways to optimize each of these three elements of a basic organic search result that you see here. Now, you'd be able to note each of these details within the basic code of your web page. Now, whether you're creating or updating your website or working with a developer to do that, you have opportunities to specify each of these using best practices so that you're attracting attention when someone in search results sees your listing like Dr. Gottlieb's there. Now, each service you offer, and this is huge, each care service should be featured on its own webpage. Two very important reasons. Each page gives search engines another opportunity to find you and to offer something from your site. So the more the better, as long as each page is naturally full of relevant information. Second, search engines will identify pages that have a single topic as a point of expertise for each. So you've got one page on one service. This is Dr. Pandit. She may have a single page on a particular foot condition. She's establishing authority on that topic by that one page. Search engines like Google are then more confident to surface that in answering a query. If you talk about all your services on just one or two pages, it's very limited, very condensed, and you're not showing any detail of expertise that Google would find worth surfacing. And it's important to remember. Now, to further support SEO, you want to think about keywords and phrases that you would pepper throughout your service pages and throughout your website. How do you do that? The simplest way is think about the way patients talk about what you do. Think about the words they use when they ask you questions. Then include those phrases throughout your site to improve your chance of showing up toward the top of results for that topic, that question, especially in your local area. Joel Headley is our director of local marketing and SEO, and he joined me for a presentation yesterday and came up with a great example. He was helping create website search engine optimization for a doctor who said their patients say talk about a cyst on their back, but the doctor was completely adamant it's not a cyst, that's just what everybody calls it. And Joel was explaining to him, but that's what you want to call it or refer to it as on your website, because that's what people are searching for when they're in need, and then they'll find you. I like that as an example. So some other tips: bring your practice to life. Not just on your website, but on your Google profile, anywhere you can. Lots of photos, physician bios, definitely testimonials from happy patients. That goes a long way. This sets the stage for patients visiting your site for the first time. You want to set that amazing first impression. So for PatientPop practices, we know that there is new site visitors. About 75 to 80% of site visits are new on a monthly average for our practices. So plan on, if you don't already track your visits, plan on knowing that the majority of your website visitors are likely new. Keep your patient base informed about any new services you have. Safety protocols they should expect currently with COVID-19, changes to office hours. I'm just giving you lots of ideas here. Availability of telehealth appointments. Once a patient lands at your site, you don't want them going anywhere else for information. And if you have an action you want them to take, usually book a new appointment, you want them to do that. So how do you make changes to your site if you're not sure? It may require money. It depends on how you access the back end of your site and what kind of knowledge you have. This may be very DIY for you. Hopefully, as is the case with PatientPop practices, there's no additional cost. You're just making changes to your website as you need.
Yes, and then let's take a look too at what you can do when you have an interested patient. You really want to inspire them here to convert and to make an appointment. One way you can do that is by offering a variety of options to connect and give them that choice and convenience. And right here, we're taking a closer look at a website that we created for Dr. Kim Nyman and her practice, Elevation Dermatology, and specifically the homepage that we're taking a look at. You can see at the top of the navigation bar, there's her phone number with that single click to call if a patient happens to be on a mobile device. And then in the middle, there are direct links to call the practice, book an appointment online, or send them a text message. And all of those are really visible, easy to access with one click. And towards the bottom of the page, there's a clear message that Elevation Dermatology is taking telehealth visits. So if you're looking for dermatological care and you arrive at this site from search, or knew their name and were researching, it's really easy to connect with this practice as a patient. And along with that too, and here's a summary that we like to use of checklist items that optimize your practice website, and a couple of items here that I'd like to point out. In the first column here, that responsive design refers to how your website has been developed, and that's the sites should be built in what's called the responsive design, which adjusts to any size browser, window, or device. So everything looks and works really well for everyone, no matter what they're using out there, at the grocery store, out and about, looking at their mobile phone. In the last column, we mention the click to call functionality, and that's what we just pointed out on Elevation Dermatology's site, where you just tap the phone number to directly call you, which is really imperative, again, for people on those mobile devices.
Yeah, before we move on, I was going to point out, if people are not familiar with responsive design, and they want to see what it looks or feels like, just start shrinking your Zoom browser window. Zoom does a really good job of moving things around, and you'll see what we mean. Most important, it helps everything look great, as Alyssa said, on mobile. And that's where we have such a majority of folks searching right now, if we're talking about Google search.
Yes, and it looks like we had a question about whether we'll be providing the slides for the presentation, and I believe we will be providing those.
I know that Carl mentioned there's a recording of this as well.
Great.
All right. So website optimization was our first factor of the checklist. Our second focuses on your reputation. A couple of weeks ago, we spoke with these nice folks, West Tennessee Bone and Joint Clinic. They are a PatientPop customer. And they mentioned just proactively the immediate benefits they were seeing from an improved reputation, specifically the number of online reviews and the improvement to their average star ratings. And as Adam Kelly describes here, their physicians were getting in the game, feeling a little competitive, tracking their numbers, stopping them in the hallway, getting excited to have a high rating. This is important enough in terms of business results that at PatientPop, our teams begin to elicit patient feedback even before practices come live on the platform. We start asking patients on the practice's behalf, what is your experience with this practice? So here's the first step in working toward that exceptional reputation and what we call web presence, which is everything. Patients can potentially submit reviews for your practice across any website that will accommodate reviews. So the first thing you want to do is make sure all your listings on websites other than your own are accurate and consistent. That's what we refer to as overall web presence. And there are specific reasons for that consistency that we'll get into. So you see a sample of websites on the right. Everyone should tell you, you want to make Google your priority. They have an incredibly high market share with people using search. On average, each month, they have about 88% of a search market, dating back to, I believe, November of 2016. They are unfailingly the king. So focus your work on Google in how you look on the professional business profiles. There are others not here, some of which you may not know that you're even listed on. So what we recommend is search your practice name, see where you come up. Then what you want to do is called claim those profiles. That's going to each site, validating that you're the owner of that profile, and then the site responds, and then you can make changes. The biggest changes, of course, are you want to make sure if there's any incorrect information out there, including contact details, you fix those right away. So we love walking through this because it's so important. Google uses your business listing to give people information about your practice. That's what they do for every business that's got a building and an address. And they have a tool called Google My Business that you can use to complete your profile, to optimize your profile. If you haven't done this yet, it's our #1 recommendation, and you would start at google.com/business. We have worked with Joel, who I mentioned. We've created a step-by-step guide to the best ways to complete and optimize your profile. And we'd be happy to get that to anyone that would like it. We've got it in blog post form. We have a webinar, any way that you'd like it. I would say just let folks know in the chat and we make sure to get it to you. Now, when your business listing is well optimized, it can move the needle. We started to say this, it can move the needle with local search. Search experts assess that this profile counts for as much as 1/3 of the factors that determine where you land in local search. The second step is building up your reviews to show both Google and patients that you're the primary choice for what you do in your area.
Yes, and those reviews are the top online resource year in and year out in our research that we've seen. 70% of patients tell us that online reviews influence their decision. And we'll take a look here too at the patients. Really, they do place enormous stock in those reviews, and they want to know and learn from the experiences of others. Those 73% of patients say positive reviews are very or extremely important when they're making a decision about a doctor or choosing a practice. And as we mentioned before, those search results will include a summary line of those reviews from that site. And that looks like this, where there's a listing from Google search results here for Dr. Mercy and for her vitals profile. And that review summary is only for her ratings on vitals. Google displays the same for other types of review sites. So there's an overall reputation that patients can see just in searching for your name or your practice name.
Yeah, the experts have referred to this as your Google homepage. Someone knows your practice, they search, and they've got suddenly search result listings with each of these professional profile sites and the line of review results. So before they even click on a result, they have an idea about how patients feel about the experience at your practice. Really important to keep that in mind. Now, there are 3 components that make up how reviews are assessed and regarded, and each has a strong influence on how your reputation is perceived. We say reputation, we mean online reputation. We know that patients make a pretty swift decision about who catches their eye based on these elements, just as you were able to in the Google business profile and in the listing that Alyssa just shared. So you don't want to lack that visibility enough that you would be ignored when stacked up against others in the market, especially in Google search results. You want to stand out. You want to have that line look good and mean something. Let's begin with total number of reviews. We know the average consumer now reads 10 reviews for any business they're considering. Maybe they're just scanning it, but they're looking at 10. You need more than 10 for a couple reasons. Decisions can be made simply by someone comparing the total number of reviews between two practices. The larger number implies greater longevity, more regular business, more engaged patients. The average star rating, why a minimum of 4 stars? Of the 3 components, this is the most important. In our research, 59% of patients said they will only consider a physician with an average star rating of 4 or higher. But there's something more important than that, and it has to do with Google search. When someone searches Google using the word best, has anyone seen that before? Someone might type into the search query, best pediatrician near me, best podiatrist in Chicago. When Google identifies the word best, they then have a search default of 4 stars at minimum. In the local pack of listings, they will only list 4 stars or greater. So if your average star rating on Google is lower than 4, you're completely deprioritized in those results. And that you don't want to be in any situation where you're suddenly not visible to people looking for care. Okay, as for what's needed for frequency, the consumer review research site called BrightLocal gives us this. 48% of consumers say a review that's more than 2 weeks old doesn't impact their decision. A review that's more than 3 months old essentially doesn't exist. 93% of people consider 3 months or older completely irrelevant. So what we did is we asked patients, if you could only choose one element, which is most important to you? If you can only choose one. And here's what they said. Nearly half leaned on average star rating as their deciding factor. That's the influence that other people's opinions are having. So knowing this, you need to prioritize 2 things the way we see it. The first, of course, is delivering to patient expectation, the satisfying experience. The second is asking them for feedback. You've done the hard part. That's the only way to actually receive testimonials with any level of volume. You ask for feedback. Our research shows, and this may pop up later in our notes, when patients are asked by their physicians for feedback, they're 50% more likely to post a review on their own online. So it's really good practice. Before we move on to the rest of the checklist, I just want to quickly share something we have for everyone, a free tool related to these types of practice improvements. We just passed more than 50,000 healthcare providers checking us out on this tool, checking and analyzing the way they look online. And we created this at PatientPop just for private practices. So you go to that URL, compare.patientpop.com/OPSC. And in about a minute, it analyzes how your practice matches up in your area with other practices on 4 online performance metrics. Reputation, meaning your reviews, like we just talked about. Google ranking. Overall web presence, meaning all of the third-party professional profile sites. And your website performance, usually speed. This is the type of insight we love sharing with practices. You can use it anytime. You can share it. It's completely free. So enjoy that. If you have any questions about it, let us know. All right. God bless you, Alyssa. I think you were sneezing.
I was, thank you. Fortunately, on mute. So next part 2, look at just getting more reviews. Really, you need more patient feedback. And the secret there is to ask for it. And we're aware that asking in person can sometimes be an awkward proposition, and it could affect a relationship with your patients. But asking for feedback is absolutely a customer service best practice, and it lets patients know you're involved, you care about what they have to say. From our survey research, we know that patients asked for feedback are about 50% more likely to then submit an online review.
I jumped the gun on that one. Sorry. I mentioned that the last slide.
Yes, that's quite good. All right. And then the goal really with that is to get that feedback at scale and make it convenient for patients and not add more work for your staff too at the same time, make it really easy for them. So here's how you do it. You send every patient an automated satisfaction survey soon after their visit. And it's part of our practice growth platform. And it's exactly what we use to get a head start on for each practice that joins us. We have a repeat cadence if the patient doesn't respond to the initial text message or email to get that feedback. This is really the most effective and efficient method. No manual work. There's a better chance at response in an ongoing way to see what you're doing really well and which aspects of your practice could use improvement. You can use that feedback to get that improvement in place before a patient even puts a more public review out there. About 40% of patients say their doctors and other providers actually don't ask for feedback. So that's really a big, huge, really missed opportunity that you can take advantage of.
Yeah, Alyssa, you started to say the recommendation is that all practices should really pay attention to critical feedback, because if you see repeated stuff from patients, you can get an idea that maybe there's something you can improve that would cover a lot of ground. Also, you see what you do really, really well in repeated positive feedback. So it's kind of a free tool in just asking. All right, here is our checklist summary for the reputation section. A couple items to point out here, as Alyssa did. In the second column about your Google listing, there are a few advanced features that you really want to take advantage of. One is to make sure that your reviews from all the other websites are listed within your Google profile. You'll see a section there for that. Another is a section called questions and answers, where you can set up your own question and then answer it. Of course, it exists for anyone in the public or any potential patient to ask you a question. But think about the one or two questions that you're likely to hear the most and that you want to share and answer for others. You can absolutely fill in your own question and then answer it yourself. It will say that you, as the owner of the practice, are answering it. Again, and in a third column on patient feedback, always respond to negative feedback or critical feedback you get from patients. We've done complete webinars just on this. We have materials on how best to do it. Again, if you're interested in that kind of content, if you'd let us know, we'd be happy to get that to you. But we know from data that you can turn a slightly unhappy patient into a satisfied one simply by hearing them out and responding to them. On to our next checklist item, ways to improve the patient experience before and after the point of care. And here's our thing. This is what we do. When we talk about the patient experience at PatientPop, we think of it like this. I personally think of it this way. The patient journey is not one appointment or one episode of care. It's an ongoing loop of action. I'm doing this, I guess, to emphasize it for myself. And patient communication that attracts new patients, that engages your current patients. And the key is when you loop back around, you're driving advocacy with those reviews, you're staying in communication with patients proactively to push return visits. So we're going to key in on what we consider the three absolute must-haves for the patient experience today, based on patient preference, based on improved productivity for you. Booking the appointment, getting to the appointment, avoiding no-shows, and then sharing feedback. Now, we talked about conversion. When that person comes to your website, they're ready to make an appointment, they like what they see. They should never have to leave your website to do that. This is a pivotal point in which patients want something easy, specifically to schedule the appointment without changing what they're doing. Think about when you're shopping on Amazon or doing anything sort of retail related. You'd never want to have to jump off to another site to quote unquote place an order or take the action that you would like to. Same goes here. This is digital habits at this point. So this is where online scheduling comes in. Taking action right away when you see something you want or need. As Alyssa mentioned earlier, click to call for mobile users, it satisfies that same need. I found you on my mobile phone. I don't have time to hit online scheduling. I'm driving, whatever the case is. click to call and they're on the phone with you immediately. Lacking both of these is just a flat out poor patient experience. And we're in such a consumerist environment for patients today. It's almost hard to think of not having at least one of these. So the benefits are kind of obvious. Higher appointment volume. You're offering an easier way to connect and make an appointment with you. Less work for front desk staff related to schedule management, especially, and this is something we specialize in, that appointment scheduling tool integrates with your current EMR or your current scheduling system. That's what we do at PatientPop. We focus on how to get that done. And in terms of time savings, how much time do you save with one less phone call? That's key. So this also delivers on a high demand patient experience. And we know from a survey conducted by Accenture, most patients want this convenience. So we have to pay attention to that level of preference. Okay, the next step meets a basic request from patients, getting that reminder. We talked about it with text messaging. So we shared statistics earlier about that. In a wish list that was done by the West Corporation, this is so interesting to me. 60% of patients said they expect a text or an online chat from their doctor between appointments. The thing that I get about this, they're not requesting it, they're expecting it. So these reminders can really pay dividends, obviously with no-show reduction, but even beyond no-show. How does a practice manage appointment reminders if they don't have it in an automated way? You probably have the old school phone list where you're calling, maybe leaving a message 24 hours out, 48 hours out. The call doesn't get returned. Okay. The problem there is you have no visibility into potential no-shows. You don't have any power to move things around in your schedule from having that intelligence. Automated reminders, you send them via text message or email, reduces work for staff. You get off that phone list. But it cuts your no-shows. It reduces late cancellations. The key is you know it when the patient confirms digitally. They get that reminder. They confirm. Now they've taken an action, so they're far less likely to no-show. That's a rare thing with voicemail, obviously. This also gives your staff greater insight into that schedule. You know which slots are confirmed. Doesn't mean 100% of the time the patient's going to show, but you've got a better chance. You know which slots remain unconfirmed. Maybe you do phone call follow-up depending on who the patient is. You know what's open. So a lot of insight by using automated appointment reminders with confirmation. Okay, the patient visit's complete. There are many practices that end the path there. They're not doing the follow-through. But when you think beyond that visit, you consider the lifetime value of each patient. You begin by asking for feedback. That's one of the best ways to start cultivating a longer-term relationship with newer patients. So people provide feedback or reviews every day on Amazon. Their Uber driver, the Grubhub takeout delivery person, personal favorite of mine. This is an enormous part of how technology has actually driven online consumerism. This is, as I mentioned, ingrained in our digital habits. Same goes with doctor visits. So when practices ask for that feedback, they make it easy. 2 questions. Patients are more likely to share feedback directly with you, with others online, across professional profiles, wherever they may see reviews. You've triggered that action within them. Most important, we tell practices, as we just said, that feedback you're getting lets patients know that you are listening. And this is a very basic critical component of what's considered positive customer service. So in conjunction with a reputation management service, there's no better way than automated surveys to build up and maintain this online reputation. Feedback tells a practice what's going well, which areas patients think that you can improve. Very helpful. And remember, every business gets negative feedback. That's part of doing business. And as you can see in the next click there, Emily, our producer, thank you. Telling unhappy patients you're listening, you want to remedy issues if you can, it directly improves that patient satisfaction, as we mentioned. So not only are you more likely to retain that dissatisfied patient, you're impressing prospective patients who are seeing the back and forth and your response online. This is invaluable. And I've been talking for too long. I'm ready to throw this to you, Alyssa. Here's the checklist summary for the patient experience. I hope everyone has gotten something out of this. We could really hit every patient touch point in the loop, which PatientPop platform does, but these three are really mandatory to deliver on current patient expectations, the most frequent and common ones. 67% of patients tell us they would switch doctors for a better, more convenient experience. What we're finding there is most people just think they're going to get great care wherever they go. That's such a wonderful, confident way to approach things. And because of that, they're willing to make their decisions based on convenience. Alyssa.
Yeah, I was going to say that one common thing for all of these really is automation. There's a lot of administrative stuff that happens here automatically, which makes that effort easily scalable as your practice grows. You don't have to worry about how do you handle all of that additional work.
Sorry, just unmuting. Okay, that transitions perfectly into the last segment of our checklist. This is an Alyssa original. I love this section. The same technology that reaches more patients, the way we've been talking about, delivers them that convenient experience, also has the potential to make for an easier office workflow, particularly at the front desk, and more efficient too.
Yes, and I'd like to first review the standard conventional ways that practices have gotten things done in the past. And these manual tools have definite pitfalls that you probably already experience. First is the clipboard, which takes up time for you and your patients. And it's a lot trickier now too, or actually not even really possible now, as the idea of the waiting room has either evolved or changed completely during the pandemic. The phone next is obviously useful when patients want to speak with someone, but there are a lot of unnecessary phone calls that your staff is probably managing, usually one at a time. So cutting those out is key. I know we can't think of another multi-billion-dollar industry too that relies on the fax machine more so than practices. And it's really the outdated way to get things done there and makes your work harder to maintain patient safety now. All of these really strain your time and hold you back from a more convenient connection with patients right now. In each item that you see here on the left can be made a lot easier for your staff and more in tune with those patient preferences by replacing it with an option at the right instead. And you know all about these, but illustrating and showing that here is a way that gives you a comparative view of how each manual task can be really swapped for a much better one. When you offer that online registration and intake, it gets done on the patient's time and you get it before they arrive. As a minimum benefit there, you've cut their wait time to start with. And we've talked about sending out the appointment reminders automatically, and your front desk staff, the front desk staff no longer has that big phone list that they need to manage. We already mentioned online scheduling, and that's going to cut down on those incoming phone calls and confirm those appointments. Having to keep an eye out for the fax machine that we mentioned before really doesn't help efficiency. So we recommend and offer a digital fax service built into our platform. And with that, faxes display on your screen and you can get notifications when new faxes arrive. One other thing too is how much patient pay that you are chasing with regular mail. The option for digital payments here and notifications by email or text can really make a big difference right now.
Thanks for reviewing that, Alyssa.
Sure.
This is what you can call virtual practice management. Replacing tasks with scalable, technology-driven communication and work, creating a closer bond with patients because that technology is easy for them, convenient for them, and satisfying your staff who's working hard. As you're pleasing more patients, they're taking greater control over patient communication, scheduling requests or scheduling period. And it makes for it makes for a day with less opportunity for burnout and a little more connection with patients from their point of view. And as we wrap up, this is what PatientPop delivers to practices. It's everything you see here in one platform, and you and your staff log in each day. This is the only way really to address how patients are looking for and assessing healthcare practices today. And all of it has a completely transparent reporting system. On a dashboard, you can track your progress. You can see how well our expertise is working for you. Our goal, as we mentioned, is to help you thrive. And we know that local practices are where patients place their trust, where you deliver the type of care they may not experience elsewhere. So we thank you for being that presence in your community. We're very proud to be able to offer a platform like this that helps practices connect with more patients, build more business, and really maintain a good day. So that's all that Alyssa and I have. If you would like more information, I know that this email address has been set up for anyone that even may think of questions afterward. And we'd be happy to get answers.